So the mama zebra out in the safari just gives birth to her baby zebra and says, "Get up, baby, you gotta run." And the baby zebra says, "I just was born. I can't believe you want me to get up and go. Let me just take this in for a minute." And the mama zebra says, "No, baby, get up, you gotta run." And the baby zebra says, "Oh, but the grass is so soft and the sunshine feels so good. I just want to lay here, Mama." And the mama zebra says, "Get up, let's go, you gotta run." And the baby zebra says, "Mama, why? Why the rush, right?" And the mama zebra says, "Baby, if you don't get up and run, the lions are gonna come and they're gonna eat you alive." A little bit of stress, right? You can feel that. You start getting a little anxious. Thankfully, we don't have lions chasing us here down a 5-Star Boulevard or any of the local streets here in Rockland or Roseville. But the idea is that stress is really prevalent in our society today, right? You would agree. And then especially when we look at it around the terms of birth, we look at the big picture of not only what we face when we become pregnant or are facing going into birth, but we've had this thing called coronavirus or something like that over the last 12 months. And it's kind of changed things for birth. And so right now, this is where I'm not good with numbers, so I have to have my cheat sheet on statistics. But right now, when we're looking at some of the stats around birth, we've got a maternal death rate that's at 17.4% as of 2018.
For U.S.?
For the U.S., according to the CDC, which is, let's just say, insane, right? And that's up from 12.7% back in 2007. So a little over 10 years, we grew 5%, which is super sad. I'll come back to that. Infant mortality has come down a little bit, so maybe we're helping those babies a little bit more, but it's only 2%, less than 2% that it's come down since 2007. And that hovers around 5.7%. It was up almost to 7%, so really just a little over a percent. Stillbirth rate, I didn't get a percentage, but there's about 24,000 births a year that are stillbirth in the U.S. C-section rates are at roughly 32%. When I was in school, it was 24%. That was 20 years ago. The ACOG says it should be right around 9 to 11%, and the World Health Organization says 10 to 15%. We have a problem, right? Currently, 50% of all kids have a chronic health condition, which means something they're going to have to deal with for the rest of their life. And I just got a couple other stats here before that I wanted to bring up. As far as 2020 goes, we have 12% of women experiencing difficulty becoming a parent or carrying a child to term. 1 in 8 couples in America encounter fertility hurdles. 12 to 15% of all couples are unable to conceive after a year of trying, and 10% of couples unable to conceive after 2 years of trying. So we're not really talking about this in the world of prenatal care and how do we go about changing this, right? And so I see that we have this tremendous problem, and when we look at where our health is headed as a nation, I think the best way to change that is to change the way that we birth and preconception care, prenatal care, all of that. So my name's Dr. Michelle Arietta, and I practice here in Rockland at Connected Chiropractic. I graduated in 2002, Webster certified. We're going to get into a little bit more about that. But when I first started working back in a chiropractic office in 1994, one of the things that stuck out for me was this poster that hung in our office, and it said, "If drugs are so bad that you have to stop taking them when you're pregnant, what makes them okay when you're not?" Right? Give me 1 second. See a tissue back here? I have this little snipple.
We've got that poster in my bathroom, actually.
Is it?
Oh, really?
Yeah. That's awesome. I love it. It's a Dennis Nick towel.
Yeah.
Poster. And so that just stuck with me. And when I got into school, it really stood out that pregnancy is this amazing time to take care of your body, to, most women stop taking some medications, they stop drinking coffee, they stop eating a bunch of sugar, they start making all these healthy changes, and it only seemed natural that chiropractic was a natural fit for pregnancy, and it ignited my kind of spirit and passion towards working with pregnant moms and babies. So, tonight we're going to talk a little bit about birth. Jump ahead. I know for birth workers, the title delivered is a little bit off-catching, and it's okay. I'd like you to keep you thinking, but we're going to get into that. The whole goal of delivered is to ensure that women prepare their bodies and minds for birth so that they can be their best when the moment arrives, so that their newborn child takes his or first breath in a way that allows them to develop as a whole, healthy, happy, connected kid. Right? So that's kind of that. We have a goal or a mission with that we would inform women about the current state of pregnancy and birth, and to provide them with alternatives towards that path, right? Because we all know you guys actually get the benefit because you work in that birth environment, right? But the average woman out there that gets pregnant, they kind of like can't wait to get to the OB, and they have like this straight line from like their house to the OB office, right? A hospital, right? They can't wait to get that first checkup, their ultrasounds, all those things, but everything, they're like, I'm pregnant, here I am, now what do I need to do? Take care of me, right? And so that becomes a really big challenge in how we look at the whole construct. So we have to kind of work on the 4 E's, I call these, to educate, empower, encourage, and enhance that process. And that's what all of us get to do, and why I love working with other birth providers, because it helps us to really change that experience and set our women up for success in the future. So, starting with education, because this is all just about the awareness and the things that we don't often talk about. I know I opened with a few statistics, but we're going to get into a little bit more about what common birth is, and I know most of you are very familiar with that, but just getting a context around that so that we can all kind of feel what a newly pregnant mom or a currently pregnant mom outside the system or in the system might feel like, right? So, delivered or born, right? And we talk about delivery, and I always say pizzas get delivered, babies get born, right? So, but that's what we're just talking about, right? That straight path, and we think that, well, I live here, and everything else is waiting for me at the hospital, and hallelujah, we're going that direction, right? But what if we change that, right? And what if we start to incorporate other options like what we're providing here? And how do we work together to really be able to build a team that helps women to feel empowered in their birth, which I think is the number one thing in our health in general. People are missing that they own the power of their own health to be able to make a change or to control the situation, and they quickly hand that over. So you can kind of see here that there's many options, and I want to put a sticker up there that says IBCLC because you're not in my slides, and I apologize, Shawnee. I didn't make them. So a couple birth stats. Right now, 8 out of 10 births today have some sort of augmented support, which is kind of sad. So that means anywhere from rupturing membranes, cervical ripening, mechanical dilators, induction with Pitocin, utilization of epidurals, episiotomies, C-sections, forceps, vacuum, you name it, it's there. 8 out of 10 is a lot. Like, that's not mean like people that go to the hospital, only 2 out of 10 are actually having like quote unquote a natural birth in the hospital. That's really sad. Like, our bodies were made to birth, and we should be far ahead of that in what we're seeing. When we look at these quote unquote routine interventions, one of the big ones is induction, right? How many people do we know, even I know Joni's out there somewhere, I don't want to share too much, but just looking at how do we get to a place where like moms aren't scared and they've got somebody saying, well, we need to induce you at 38, 39, 40, this whatever weeks, right? Well, when did somebody outside your body decide something was better for what's in your body than what you know, right? That person wasn't there the night or day or afternoon that was created, right? It didn't have to say, okay, little sperm and little egg, let's grow together and start this process, right? That's an innate ability for us to be able to birth or to conceive and to grow and to nurture, and that by the time we get to when that baby's going to come out, nobody ever worries about the cow in the pasture that's wondering, when is that cow coming out? We better start getting on it, right? It'll just do its thing. So, some outcome risks that we see with induction with Pitocin is that we see decreased fetal heart rate. And what does that do to mom? Stressful? Unstressful? Stressful, right? Harder and longer contractions?
Very stressful.
Very stressful. With Pitocin in general, as you guys know, because that just creates more artificial contractions, right? So your body doesn't get a rest, there's much more exhaustion, those kinds of things that happen with Pitocin. We're 2 times more likely to end up in a C-section if you go through an induction, which is sad. I think a lot of these statistics, like we talked about, are leading towards our increased mortality of mamas with that. higher probability of an epidural, and reduced rate of infant breastfeeding, because by the time they get to that point and you actually get a baby out, you're exhausted, you're drugged up, you're kind of at your wit's end, right? And so that's a big problem for me. When we look at the shot clock of an epidural, like getting it in on the right time, that's the other second, I think, most utilized augmentation to birth, leads us into longer labor times and difficulty, right? Because once we use an epidural, everyone's thinking pain, right? But we're not thinking about function. And when we block out those nerve systems that are controlling the pain patterns down there, they're the same nerves that control our uterus. And we're going to talk a little bit in the future about power, passage, and passenger. But if we block down that nerve passage from the nerves that go from your brain to your uterus and you lose the ability to contract powerfully, that just slows us way down, and then we become less effective. And then they say, oh, you're stalling out, right? Mm-hmm. And we start to see this pattern that we see over and over and over again. 3 times the risk of severe perineal tear, which happens because you can't feel anything, you can't control your push, you're just bearing down as hard as you can, probably on your back, not any fun. 4 times chance of posterior presentation, higher probability of instrumentation, meaning they have to either vacuum extract or use forceps, aka salad tongs. And then the increased risk of pelvic problems, hemorrhaging, tears, pelvic floor stuff, all those fun things. So, and our world balance is the key. So just for a second, we're going to talk. This is one of my favorite quotes. We have it hanging in our office, and it says, "You cannot be in growth and protection at the same time." We can look at it. You cannot be in life and protection, or life and fear at the same time, right? And that's from Dr. Bruce Lipton. We'll come back to that in the key with the nervous system coming up. Once we get through all these inductions, we get into more birth trauma, because what we're seeing in those kids that are lending us towards that 50% that have chronic health conditions can lead to allergies, which is 1 in 4 kids right now. 1 in 10 kids has asthma. 1 in 8 children, ADD, ADHD. Autism, 1 in 68 currently. I think it's coming down a little bit, which is scary. Our childhood obesity, type 2 diabetes, learning and behavior difficulties, anxiety, prescription drug usage, and other like true epidemics that are plaguing our kids, they're totally on the rise right now. And that all starts from this very first process of how they started life in that fear model or stress model, that they're not able to attain good, strong health from the get-go. We call that the perfect storm if you can't see that. So, it's time we start adding in some pieces to start changing the way that we look at that, and how do we go about that. So we talk about the road less traveled, and there's many different things we know with amongst you guys about having doulas and midwives and support and photography and home birth, and like just it's so wonderful when we can start to change that perspective that we were created to birth and have these beautiful little humans, and we want to turn it into like this diagnosis and this sickness that has to be controlled. And that's just not the way that it is. So we're going to go down that little road less traveled, not for you guys here, but just looking at for our mamas that we serve, is encouraging them down the road that we do have an opportunity that you can stay in control of your birth plan, right? And I think that giving moms the power to sit and process that out is super important, right? All the doulas in here know specifically, because I think that's one of the biggest things, is that you get to support moms in that process to be able to hold their plan, right? And to go to battle for them, so to speak, or like support them and extend your wishes, right? We were made to birth the same way that we were made to procreate, right? We have the hips. Catherine has this beautiful model, right? And the hips, this is the passage that we talk about, right? And the ability for it to expand, right? As birth gets ready and baby can open up, or the pelvis can open up so baby can come through the birth canal, right? Super amazing in that aspect. We know that we can create environments where it's a more comfortable delivery, allowing you to achieve your ideal plan and having less trauma in that process, and obviously less risk of C-section. So, when we look at more natural birth, we're looking at a lower risk of respiratory complications. We'll cover that more in a bit. Stimulating the cardiovascular system, providing naturally protective bacteria, baby benefits from hormonal surges, and a 20% lower risk of type 1 diabetes through natural childbirth. So it's fascinating, but I mean, the way I'm a God person, so like the way God created us is really magical, because all this is just by you going through the birth canal naturally, which is freaking awesome, right? We don't have to worry about any of that. We also know that non-hospital births are 4 times less likely to end in a C-section. 84% of women who plan an out-of-hospital birth achieve their goal, which is rad. And non-hospital births can still be covered by insurance, and even with that, they're oftentimes still less expensive. Ta-da. Let's see if there's anything else I want to add in that. Okay, so helping your clients to whichever way, I think that's what I love about the Birth Collective the most, is we have all these different providers and different people that can assist and help, and we can kind of just come around this community. And if we can change that here in Rockland, Roseville, Lincoln, South Placer, whatever we want to call it, right? Then we start to change the community, we start to change our county, we start to change our state, and the ripple effect from there gets really big, and I love that. And so encouraging mamas to have more options and letting them have the power is super important. So the next phase we're going to head into is just about that. How do we empower moms? Because I don't want this to be all doom and gloom, like, oh, this is horrible, and like, I'm not trying to blame the OBs or the patients that are doing it, the moms that are choosing these things, right? There's no blame in that. But if we could take a stand to be able to help them and to move forward into taking control of what their plan is and what they want, and truly there's probably some people out there that have just gotten to a point, they're like, nope, I've seen them. I'm just doing this, that's just what I want. Okay, good, well, I'll respect your wishes, right? But it doesn't have to be that way. And I think the more stories that we get out about people that do birth at home or free birth, you radical people, you awesome. I love this quote. So if you want to go fast, go alone, and if you want to go far, go together. Did you actually share that in your talk last year? I feel like you might have. It's a good one. It's an African proverb. And that's the beauty of like what we do here, right? People can go at it alone, not in the alone of free birthing, but like, but we have so much resource here in this group that we have the ability to really change that for our moms and really have them have like the full extent. And remember, like my long-term goal is not just getting them to that healthy birth, but like how do we change the story, right? And I think birth is just where it begins. So again, this little line here is going to be my sticker of IBCLC, but it's okay for people to still have an OBGYN. Doesn't mean that they can't. That's fine. A lot of medical insurance covers that. Prenatal chiropractor, obviously, yoga and exercise, acupuncture, massage, family and friends can be a great resource, right? Midwives, doulas, birthing class, nutritional support. I've been to 18 births. My first one was 26 years ago. Just people that were just like, can you just be there? You always present this like calm, which is kind of a weird thing that I never saw in myself, that people are always like, everything's always okay if you're around. And I'm like, okay, sure. But it's fun. And that's kind of another like path on how I fell in love with birth. But it's a great way to support that. Midwives, doula, birthing classes, and nutrition, all super important. Oopsies. So, Ina May Gaskin said, we must remember that the mind-body phenomenon described in 9th and 10th century textbooks is no less true now than it was then. So most women need encouragement and companionship more than they need drugs. Right? There's actually this is a total side note, but there's addiction studies too that talk about that addiction is more about companionship than it is about the actual drug, right? They've done lab tests where they have a rat with cocaine by itself in a cage, and it will eat that cocaine to death, literally. But if they put 2 rats in the cage, then and the cocaine, they leave it because there's companionship. It's kind of interesting just to look at that. So bringing that fear level down and having people know that it's okay. So chiropractic, we're going to talk a little bit deeper in how does chiropractic help with all the stress aspect. Like I said, I graduated in 2002. I was Webster certified right as I graduated. I did the schooling and took the test right as I graduated. So I've been doing this for a long time. Webster Technique, we're going to talk about a little bit more, but I've had, I don't know, I really want to go, I can't go back in past practices, but like just the hundreds of moms that I've served and the handfuls of people that have had great success through Webster Technique in my practice, I think I can count on one hand the number of people that didn't turn, and we'll talk about that here as we go through that. But really just helping moms, and I just think, like I said, going into that aspect of helping lay the groundwork and the foundation, if we can change that through prenatal chiropractic care, through healthy natural birth, through supporting moms and taking back their health as moms, we start to change the story. So, oops, go, stuck, Catherine.
That was the link that I got.
Hmm?
That's just the link that I
It'll keep going.
It went forward just a second ago. So
Did it?
it'll keep- Yeah, because I should go backwards.
Oh, I don't think it's gone. Oh, there we go.
No, that was.
Okay, we can keep talking. Try it again. I can just scroll through if you want. There we go. Okay.
Oops.
I have to leave it minimized.
Cyber gremlins.
Technology is like not my jam.
Me neither.
And I like it
Not
because
mine
it's fun to
either.
feel like you did something. I'm like, I would be better if
You
I
might
just.
just have to do it.
That's fine. You guys can look at the side stuff. I don't really think it's on there. All right. You okay?
I'm good, I'm good.
Okay. So, a lot of people think Webster Technique. What is, just to get like a crowdsource here, what's the first thing you guys think of if you know anything about Webster Technique? Do you know anything about Webster Technique?
Pregnancy.
Catherine, help us out. I know you do.
It's really using,
Act like a normal person.
oh,
Not a
sorry, okay, normal person. It's just the way chiropractors adjust pregnant ladies.
Sure.
Special.
Right.
That was the price, that's all I know.
It's
Yeah.
extra, it's extra special.
So the special thing is that mostly Webster Technique was centered around working with transverse babies. Although as chiropractors, we're not OBGYN, so we don't work with the baby, we work with the moms, right? But that's like the number one thing. So a lot of times I get referrals that come 35, because we don't really worry about transverse babies until after 32, 34 weeks. That's usually when people start to go, oh, right, now we better do something about it, right? And so a lot of times it's kind of a last minute dash, which can still have super great success rates if we get them in and can get them on a care plan that helps them to get to that goal. But Webster Technique, they're really specific because we don't do baby turning or anything like that. And the other thing is like chiropractic and pregnancy is people think like pregnancy related back pain, right? That most people would go and they're like, well, Webster certified means you work with pregnant moms. There it is, right? So that's it. So, but the specific, Webster Technique is a specific chiropractic sacral analysis and diversified adjustment. And the goal of the adjustment is to reduce the effects of sacral subluxation or SI joint dysfunction. And in doing so, that changes the neurobiomechanical function of the pelvis and allows for things to work the way that we were created to, right? So it's really, in a simple term, it's an analysis and an adjustment that helps to reduce nerve interference going to the uterus and the pelvis and the muscles of the pelvis so that the pelvis can be open. And we know that naturally, because we were created to birth through the vaginal canal, that would allow baby to have plenty of room and space. So in terms of like dystocia and stuff like that, so that they can go head down and do their job with that. And subluxation in the sacrum can contribute to difficult labor. So like if moms that are not getting adjusted, this is some things that you'll hear too, or if even seen, like if you've been at birth, is that mom's like failing to progress, or the baby's getting stuck, or that canal's not opening up. Those are oftentimes because there's so much torque and tension in the pelvis that it's just not allowing normal physiologic birth to occur with that. So correction of that subluxation will have positive effects on dystocia as well in helping babies to get out. And chiropractors, like we say, and this doesn't necessarily, in my opinion, as much as I love and I've invested thousands of dollars into working with prenatal moms, it doesn't mean that other chiropractors can't adjust that subluxation. We just have a little bit more experience and a little bit more focus, and in my opinion, for me, I have a lot more training that I've invested in to do that so that we can do that. But don't be afraid, like, of other chiropractors, if you have a good relationship, that could be a possibility.
And can you tell me what dystocia is?
Dystocia, it's basically just a slow progression or like
Well,
stuckness.
The technical shoulder dystocia is when the shoulders get stuck.
That's on the shoulder, but you can have
Oh.
uterus, like,
Yeah,
just in
just
general.
difficult labor. is just-
Difficult labor.
Yeah.
Okay. So I
But that can encompass a number of things.
Okay.
So,
Can I ask a question too?
yeah,
Do you, if a woman was having a difficult labor in the middle of labor, would you go to women in labor to help?
I can if it's a home birth.
Well, yeah.
Can't in the hospital.
Right.
If it's your
I
like
don't have
established client.
Yeah, and if it's my established client.
Okay,
I'm
so
happy
you
to do
couldn't
that.
go to like.
I
a
couldn't just show up
random
on
new
scene
person.
like, oh, you're not progressing, let me just get Dr. Michelle down here and she'll totally like hook you up, right?
Yeah.
No, yeah, they should be, thank you for saying that they have to be established, but
Just
I'm happy
liability.
to.
I wasn't thinking.
And there's a few of those
Liability.
births that I've been at that have been home births with my clients, and they're like, oh, please come.
Yeah.
And
But
we
just
can
kind
do a
of-
little bit of work sometimes. Sometimes I'm totally hands off. Like, I'm not really there to be a chiropractor. I'm just there to kind of help support them and like answer questions and if they need things. And I really love, one of the things that I love to do in my own practice, well, not totally related to this, is helping partners, right? And teaching them how to support their pregnant wife or spouse or partner or whatever, so that they can do a lot of those work and pressure points and squeezing down on the pelvis and probably things a lot of doulas might end up doing as well, or massage therapists and so forth with that. So Webster Technique is specific, it's non-invasive, it's functional, and we have a huge success rate in my office. Like I said, I can count on one hand, I think, I had to really like go back hard on this, of people that have not turned, so to speak, or gotten their wishes in that. One was a gal, she's actually a chiropractor now, which is awesome. She was transverse, I got to work with her. She ended up birthing Frank Breach and ended up having a really short umbilical cord, like less than 12
Yeah,
inches.
sometimes there's a reason.
Right? And so there's a reason, like innate intelligence knows within us that there is that possibility. Another one was last summer, and mom is a nurse, and she was just, her lifestyle was just full tilt. And I couldn't get her. I saw her, I think, at like 34 weeks. So I had like 6 weeks with her, which could be, sometimes enough. But she wanted to work all the way up to her birth. She didn't want to slow down. She didn't want to do that. And we can't, like, remember that slide that said you can't be in growth and protection at the same time, right? When we're in fight or flight, we are not in growth mode. And so that does not allow the body to come down and work the way that it's supposed to. And the other two are people that didn't want to follow my recommendations. And ultimately, I can only lay out what I can recommend, right? And so I've had a really high success rate in working with that through the years, over the last 18, 19 years. So, chiropractic benefits for the mom. It prepares the pelvis, like we were talking about, for an easier pregnancy at birth. It removes tension on the ligaments that support the uterus. It reduces interference to the mother's nervous system, and it allows for easier, safer birth. Studies have shown that it decreases labor times and intensity, which is awesome if you can share that with moms, right? They want to know that. And it decreases that risk for intervention. Benefits for the child. Removes interference and allows for better baby development. There's more room to develop cranium and spine and skeletal structures when they're kind of free flowing, right? Imagine yourself like living in a closet or living in a big room like this, right? If you start living in a closet, we start to feel like we're really stuck. Or a better study is like when you have a dog that's been on a chain and you keep shortening that chain, all of a sudden you can take that chain off and they won't go anywhere, right? So same type of principle there. Allows, yeah.
Oh, sorry. Can you hear me? Sorry to interrupt. The video cut out. Oh,
There we go.
there we go.
Just one sec.
Okay, thank you.
Yep.
So allows baby to move into the best possible birth position like we were talking about. And then proper position decreases in dystocia and reduces potential for intervention with that. The other thing that I want to talk about here on this slide, when we talk about benefits of chiropractic care, have you guys ever walked into a room where you know somebody is like either super stressed, right? So we can feel that. And the hard part, and this is not again a guilt or shame thing, but when you've got a little one living inside of you and you're in that stress, that neuroemotional connection to your baby, they're experiencing that same level of stress. It's one of the things I always talk about.
We were on the clock and we went all the way to 42 weeks. 41 weeks, 7 days, and like 13 hours before I went into the hospital. But I'm wondering if, Webster could have helped as he ended up coming down, because we were like really doing all kinds of stuff to try and get him out of me, but not chiropractic care. His head was tilting backwards instead of forward, and he ended up mouth to cervix, and I had to have a cesarean birth. And I look at this and I'm like, oh God, had I only known,
And now you know for your next one.
Man.
Or if you're-
And
Share your
this is
story.
why we want,
Yeah.
right, this
Yeah.
is why we want this to get out.
No, 100%,
For women to
because
know.
there's a gazillion pregnant moms, I see them all over the place, and they're not all in my office, and I doubt that they're all over in Catherine's.
Yeah.
Right? I mean, there's a lot of people, and they don't know that they have options.
don't
They're not
know.
told that they have an
Yeah,
option.
right.
They're told that if this baby doesn't turn, we're going to give you a C-section.
Yep.
Mhm.
And I've
so
watched,
they think that's their option.
the cool thing, and I'm sure you guys have this experience too, but like the different births I've been through, when you see moms, because I've had a couple moms that have gone through and been induced because they're just like, I'm done, and I get it. Like, we all have our own experience, right?
Mhm.
And I think the big key is that, one, we want to protect mom, and we want to protect baby, and we want that to be the best situation possible. But sometimes mom's sanity, like we were talking about at the beginning, we don't need to be like these martyrs as moms,
Mhm.
But the idea is that when they induce, it turns into this long drawn out process, and like most of them end up in C-section. I said, gosh, if that was ever the case, like at a level, I could see like, why wouldn't you just go to the C-section and skip all the drugs and the exhaustion and the whatever. I'm not saying like that's my plan or like,
Right.
in that aspect, but it's just hard to like put your head around that, because why would you just fill this mama up with drugs that many times cross the blood-brain barrier,
Yeah.
and then you end up with this exhausted mom 3 days later who has a harder recovery because she's in C-section and she's exhausted and she's this, and now you have all those other delays that we talked about at the beginning. We don't get good breastfeeding, we don't get all those things that come together, right? And so it's just kind of,
But we do get a patient for a longer bit of time.
that's not nice.
It's
That's
the
not
truth.
nice, but it's true. So when we look at birth, these are some pictures, but the body is, when it's not at ease during delivery, this is what happens. So kind of what you were saying, Megan, and this happens for even people that are active and healthy and try to do all the right things, right? Chiropractic for many people is often the one missing link that gets them to that point, because they can be eating well and doing their prenatals and doing all the things, but if they're not taking care of their frame and structure and helping their nervous system to do its job it was designed to, we can see here forceps or vacuum extraction, which I just can't even imagine. I just think birth in general, like when they start getting their fingers in there and they start tugging and pulling, right? Nobody would let their 2-day-old baby be picked up. Oh, what a sweet baby, let me pick you up by your head.
Well,
Right.
especially while someone's pulling on
Well,
the
then there's
other
that
side.
aspect, right?
Right.
Which they can say like 30 to 40 pounds would be typical of pressure. Your baby only weighs 8
Wow.
pounds. That's a lot of tension on that upper cervical spine and head that they're really starting to rock with. The other one is the anterior presentation. On that, where like if baby doesn't have that connection to know what it's supposed to do, and this is another thing I love to tell moms, this is another side note, but when we look at that neuro-emotional, chemical, physical connection with the baby while they're in utero, remember that baby has their own innate intelligence and they're working with you too. When we start to medicate that down too, they lose their connection to mama as well. So it's a both and we always are so focused on the mom, but we gotta remember that the baby's a part of this process too. And I think it's really important for moms to stay connected to their baby so that it helps that birth process as well. Wait. No, come back, come back. Ah, I suck at this. Not the talking.
You're doing great.
I hit something at the bottom, so you think you just have to go back on your little pictures. There it is.
Oh, okay, if you just, swipe through your fingers.
Okay. So talking about birth trauma, just to extend onto that, this is a little bit deeper into the aspect of how we change, right? So there's a lot of things that are happening. There's many reasons people like to get in discussions. I think it's important to have a lot of conversations around a lot of different things as we get into this, which is why I need all you guys too on the team, because there's many things we look at, nutrition and exercise and emotions and whatnot. but in vaccinations, which isn't necessarily my specialty per se, but we need to address it. And people think, oh, this is all because of vaccinations, right? This is where we've got autism rates through the roof because of vaccinations, and we've got this because of vaccinations, and we've got asthma and allergies because of vaccinations. And I say it's possible, but I don't know, and that's not my key point. But the thing is that what we often see when we look at this perfect storm of how we're birthing and what we're bringing into being right now is it's kind of a perfect storm. So walk backwards with me. So we talked about some of those fertility rates and the struggles of moms getting pregnant. There's a lot more fertility drugs being used, which is chemical stress to the body, right? They have a high stress pregnancy because they had a hard time conceiving, or it's COVID, or it's this stress, or everybody's at home and I'm losing my mind because I have no space anymore, whatever it is, right? And we're walking this path, and then we have this stressful pregnancy, and then we lead to augmented birth, right, in some way of induction, and we have more chemicals and more stress, and then we end up in that augmented birth, and then that wasn't natural, so now we don't have the vaginal seeding, and we don't have the respiratory reflex, and we don't have all of that wonderful stuff squishing all the fluids out of your lungs as we go through the canal, and all these things start to happen. And then we don't get good breastfeeding because remember we went through that 3-day process. Mom's exhausted, we're not getting good latch, we're frustrated, we're exhausted. We'll just formula feed, right? And they got their K shot. Yeah, I'm like, yeah, that first little shot, right? And then they're formula fed, and then mom's stressed out and tired, and we have this pattern, and then we get these kids that start to develop colic and sleep issues and reflux and constipation and difficult nursing and torticollis or plagiocephaly, which is the misshapen heads where we're seeing a lot, and a lot of that gets tied up with tongue ties and things like that, which is not on here. ADD, sensory disorders, autism, ear infections, respiratory allergies. This is what we call the perfect storm. There's a whole list of stuff here, all the way up to autoimmune disorders. And so when we look at that birth and that process is so vital to changing the future because we can't have moms doing this. And we're seeing more and more fertility clinics, we're seeing more and more drugs, and more of that. And that is killing our future. And we don't have the ability to have healthy kids anymore because 1 and 2 is going to end up with something chronic like this. It's horrible. I know you can work. Okay, you can't work. It's okay. We're close to being done. We're in the empower. So, last bit of that is getting into.
Poor Catherine.
So,
What am I doing here?
that seems to be the thing.
Okay.
That's it.
Whoa, it was the what?
The pad. The pad and that little arrow in the bottom. That seems to be working better.
This guy? Okay. So creating that balance, and like so when we talk about that perfect storm, then we got to create more balance. We got to get people out of that fight or flight. We got to get people back into growth and into life and into like vitality is a word I like to use. So chemical stress, physical stress, emotional stress, subluxation, that all puts us into fight or flight, right? And if our body can't adapt to that, then we've got a problem. But things that we can do to help that is eating clean, moving often, being happy, and getting checked by a chiropractor and building the team as well. So, reduction of stress and anxiety in pregnancy may have a significant and long-term benefit to our offspring and therefore substantial public health benefits. And evolving evidence suggests that some forms of relaxation and relaxation training may improve not only physiologic and hormone stress markers, but also meaningful outcomes in mothers and babies. Still good. So, encouraging your mamas at the end here. So, right? Healthy mom, happy mom. Healthy pregnancy, healthy baby. Relaxation, exercise, massage, acupuncture, chiropractic, wellness diet, right? The whole package we want to encourage these people to do. And I know sometimes it feels hard and overwhelming, but if we can do it in a systematic way that helps them to have access and resources, and when you understand the why we're doing this, to be able to change the future of our kids, we have a much better outlook on that. Movement and exercise. One of the key things that I want to just touch on here, because I know we're getting short on time, is that I want to be able to talk about that exercise during pregnancy isn't the same like it was pre-pregnancy, right? And we want to be really intentional, especially if we can work in things. I've always recommended prenatal yoga because being still and trying to downregulate as opposed to pushing hard. I know there's moms and I know even in this room, I'm not trying to be offensive, but like, I'm not a fan of moms doing CrossFit while they're pregnant, even though you can. It's just hard because that type of activity drives us into fight or flight. And I know there's a recovery period, and I know it's not like trying to have a big discussion, but when we look at how much stress we have, we want to be able to honor and help those moms to get to a space of opening and not constriction. And a lot, even though I know CrossFit focuses on mobility and, you know, recovery work, but just really helpful to have that. And so remembering that it's okay for your exercise not to look the same during pregnancy as it did pre, and you can get back to doing those other high intensity interval workouts postpartum as well.
Think about just safely modifying.
Or modify.
Safely modifying, yeah.
Yeah,
Because even modifications are still not safe, so.
Right.
Yeah.
safely, yes, that's very true,
Yeah.
very true. So, and making sure that you're in a box where somebody has that. This is a key thing I want you guys to take away tonight. We talked a lot about stress, and all of us are exposed to stress all the time. And stress necessarily isn't the bad guy per se, but how we adapt to stress and our ability to adapt to stress is where we really have the biggest impact, right? And because the nervous system, so we talked about like that pain at the beginning, like people see chiropractors during pregnancy because we have pain, right? That's like 10%. The other part is working in those two major systems of our autonomic nervous system, which is fight or flight or rest and digest, and birth, we'll add in that, right? We have to be in that rest and digest mode for us to be able to do that. When we have vertebral subluxation in the spine, which is where it could be something like this. This is going to be exaggerating, but if I have right head tilt and I'm kind of stuck this way, this is creating a stress response to my brain. Do I feel stressed right now? Nah, right? But my brain's going, Houston, we have a problem, right? And that sets off within us automatically a cycle that says, boom, we got a problem. Fight or flight, protect, fear, right? When we have things right now that we're exposed to a lot, like seeing people in masks, protection, fear, danger, right? You may not necessarily feel stressed, but the innate response is fight or flight, right? If you start breathing in, even though it's not high amounts, but if you have and I'm sorry, I'm not picking on anybody, but if you have a mask on and you're breathing in CO2, even if it's a little bit of CO2, not like you're gassing it in your garage with everything shut up, right? But that little bit of CO2 creates a response in you that says fight or flight, right? So we've got all these pregnant moms, if they're wearing masks, if they're doing these things, right? It doesn't have to be a big thing that sets us off into that. The number one thing that helps us to overcome is having a clear nervous system and increasing our resiliency and adaptability. And so when we have the presence of subluxation, our brain can't decipher between physical stress, like I got in a car accident, or I'm pregnant and my body's way different. It doesn't know if it's emotional stress, like my kids are driving me crazy, or chemical stress, like, I don't know, I didn't cook dinner and we went through In-N-Out or whatever it is, right? So normally those things should be okay, but in the presence of subluxation, it deters your body into a further rapid cycle of degeneration. And that's when we have a failure to adapt. And so when we start to get adjusted and we can shift that, our body goes so that we see a better expression of life, we see a better perception of life and an outlook, and then we get better coordination and function through all those things, and you can adapt and do things better through that by getting checked. So super important in that aspect. If there's one thing that I want you guys to think about when you think about chiropractic care, it isn't about pain, but better adaptability and resiliency. Chemical stressors, they say, just a touch here, they've done studies, and I do have these if people want them, just reach out or we can comment, tag me in this post, and we'll get them out, but I have the resources on this. So they found in a benchmark study, they had 287 chemicals in umbilical cord blood.
Mm-hmm. I saw.
217 of them were carcinogenic.
Uh-huh.
That's disgusting,
Oh my goodness.
right? And
Makes me
so,
want to get checked, but then I'm kind of nervous, like, do as much as you possibly can to eliminate, but then you're like, what else is
we do,
there?
right?
Oh.
But remembering that your body can adapt, and the more you keep your body in a state of adaptability, the better we are at overcoming those, right? 208 of those cause birth defects and abnormal development. Sorry, I had that backwards. 217 are toxic to the brain and nervous system, and 180 were known to cause cancer out of that. So, kind of crazy.
So you said, Michelle, you have that.
I have the resources on all my
resource?
stats.
Okay, great.
Yeah. And I might just publish them to the group.
I remember seeing that stuff. Well, because you have women who will do everything like really all natural, and home birth and no added, and there's still,
I know my
Yeah.
Nana.
It's,
What does it make
still
you
baby
go-
comes out with ties, and then
Well,
that's
yeah.
where they're like, why, I did
I think
everything,
it's-
but it's like,
it's, I mean.
when did you, like, it goes so far back with
Yeah.
our bodies, like,
From your own
even
childhood.
yeah, what we have in our
Your
bodies.
grandparents, your grandma.
Yeah,
got.
generationally,
Generationally,
what you're exposed to,
huge.
epigenetics and,
Yeah.
Epigenetics is huge. They say you can go back 14 generations. That the things that we carry in us,
yep.
you can trace back 14 generations.
So you can
In
do everything right, and
environmental
the child
stuff.
could still have issues.
Yes.
I know in that study they talked about some
So do the best you
chemicals
can.
that they found in the fetal cord samples that haven't even been around for decades. So it's just that, just what you're saying, just shows that it gets passed on
Yeah.
generation to generation.
Another, since we're talking about a little bit of diet and stuff too, GMO foods, the studies, and I was trying to find this, I heard this a long time ago in a class, and the information stuck with me, but I need to go back and get the source, is that, so this one is unsighted, I don't have this information, but that GMO creates sterility in rats in 2 generations. So, hello, genetically modified farming that we've had over the last, since like the 60s,
We
50s.
learn why there's so much infertility.
We now know it's one of the key things as to why we're into this high infertile aspect. Do you need a plug or?
Yeah, I'm looking for an outlet.
Over there, over
Okay.
to the right of that door, yeah. You can just unplug something.
So kind of like we were talking about chiropractic care with the wellness diet, reasons for exploring a more natural birth. Ideally, it would be the best opportunity for mom and dad, I'm gonna bring both into this, to have chiropractic care 6 to 12 months before thinking about getting pregnant, right? To really optimize your body so that conception becomes easy and optimal. And I have programs in my office. One of the deep studies I've done is into preconception work and helping people through that process. Eating whole, living organic foods. Again, I just talked about that GMO study. Providing healthy fats or prioritizing healthy fats. Not getting a lot of additives, dyes, caffeine, those kinds of things. And then also looking at your blood sugar regulation. And sodium regulation, which in my world, sodium regulation does not mean adding sea salt to your food. Sodium regulation means packaged foods for me. Because people get afraid of sea salt, but I think sea salt is one of the best things you can put in your body, specifically while you're pregnant, because of all the trace minerals. Lastly, enhancing. So as providers, we really want to encourage our mamas to take the wheel, to take control, to know how incredibly amazing their bodies are, that given the right opportunity, they can have like the difference between this beautiful, like ideal birth that they want versus going towards a hospitalized trauma. I mean, there's a lot of birth trauma right now happening just because we have these horrible things that moms lose their power in the hospital, right? And that breaks my heart when I hear those stories where they just feel like their wishes totally went out the window, right? And I think it's rude that providers, and I know I'm speaking to the choir here, but that providers think that they have the power to override a mother's wishes about what they want for their body and for their child. It's really, really sad.
Well, and beyond that, it's not even just overriding, but casting fear to manipulate them into making a decision
Yes,
they
that
don't
everything
want.
is worst case scenario.
Because a lot of times the women are agreeing to it
Yep,
because the way it's presented is
Right.
that if you don't.
they didn't have an option.
Coercion.
I was gonna die. I've heard that too. Some of the births, I think that we were heading towards maternal or increases. I've had a couple of my moms that I've gone hospital births, inductions, so I've had like 3 of those I've been at, and they all didn't end. Baby got here, which is great, but a lot of hemorrhaging, a lot of, and they're like, oh, you can't, and then they tell mom, you can't have more babies, you're gonna die next time on the table. Awesome, right? There goes my dreams of having a bigger family. I get 1 or 2, right? And they just say, well, I was gonna die. Like,
Right.
you don't even know. And like, well, yeah, but look at all the things that they did to help you almost die, right? They won't look at it that way. They just think they totally saved my life.
That's like the most common when I try to talk about maybe a home birth or a birth center, that's the most common answer I get. Well, I almost died at my last birth because I can't do that.
Then you really need to do that because you shouldn't die in birth, right? It's not 1877 anymore, right? We have much stronger bodies. We have much more able bodies. We have the ability. We have more resources. I have a girlfriend, not at her birth, but we graduated together. She did home births, and she had her placenta ruptured post delivery. And so they got baby out, midwife knew exactly what she was doing. They transported, she's fine. She's got 2 beautiful kids, like amazing. And it doesn't have to be fearful to be at home because 911 can be there super fast. Most licensed midwives know exactly what they're
As
doing,
long as you don't live really far.
right? Well,
They
yeah.
found the same happened to my friend too.
She was in
Yeah.
Fresno, so I don't know how long it
Yeah.
takes to go or where,
The
but
doctor said her midwife saved her life by what she did to get her to the hospital and her placenta ruptured.
midwives are smart.
Yeah.
They know what they're doing. They're well trained and
Yeah.
just like any other provider. So, love that. So, making sure that we're all educated. And I love this. Like, makes me really proud to be a part of this organization because I really love how we can learn from other people and know what's available. And so, the more educated we are, the more we can help our clients to get access to better resources. Making sure that they have a plan, staying focused, and then remembering that we all got to maintain balance, right? Preconception, prenatal, postpartum, parenting, all the way through. Life is a balance. And the more that we stay in that growth mode and instead of fight or flight, the better that we're going to be able to adapt and move forward. So when we're mapping the journey of your birth, don't let anyone else take the wheel, right? Let's keep that power in the mamas and let them have the births that they want. I think that concludes our night. So take the wheel, choose your team, and enhance your birth. It has been
Awesome.
a huge pleasure being here tonight. If you have any questions, I'm always available. You can reach out on Facebook or Dr. Michelle at My Favorite Chiropractor.
Or tag this post.
We'll tag it, yeah.
Yeah.
We'll tag it. And like I said, I will get the resources up if you want the statistics. I know Joni was looking for some stats and research on that. I don't have the specific question, but there's some good information there that she can take.
Do you guys mind if we